You sit down, you eat a normal meal, and then within minutes, it hits you. A wave of dizziness, lightheadedness, or that unsettling feeling that the room is slowly shifting. You did not stand up too fast. You are not sick. You just ate. And yet here you are feeling like something is wrong. If this happens to you regularly after meals, doctors say you are not imagining it, and you are not alone. Millions of adults experience post-meal dizziness every single day, and most of them have no idea what is actually causing it inside their bodies. In the next few minutes, we are going to show you exactly what happens inside your body the moment you eat, and why, for some people, that process goes quietly wrong in a way that causes dizziness every single time.
To understand why dizziness happens after eating, you first need to understand what your body does the moment food enters your stomach. Digestion is one of the most blood-intensive processes your body performs. The moment you begin eating, your digestive system signals the body to dramatically increase blood flow to the stomach and intestines to power the complex work of breaking down food and absorbing nutrients. In a healthy, well-regulated body, this blood shift is managed seamlessly. The heart rate adjusts, blood vessels in other areas compensate, and overall blood pressure stays stable. But in many adults, particularly those over 50, this compensation system does not work as efficiently as it should. When blood rushes to the digestive system, there is less circulating blood available for the brain. And when the brain's blood supply drops even slightly, the result is exactly what millions of people experience after every meal: dizziness, lightheadedness, and that unsettling feeling of unsteadiness.
The most common medical cause of dizziness after eating has a name that most people have never heard: postprandial hypotension. Postprandial simply means after eating. Hypotension means low blood pressure. Together, they describe a condition where blood pressure drops significantly within 1 to 2 hours of finishing a meal. Research from Harvard Medical School confirms that postprandial hypotension is extremely common in older adults, affecting approximately 1/3 of adults over 65. It occurs because the autonomic nervous system, the part of your nervous system responsible for automatically regulating blood pressure, becomes less efficient with age. When blood rushes to the digestive system after a meal, the aging autonomic nervous system is slower to compensate, allowing blood pressure to drop before it can be corrected. This drop in blood pressure directly reduces blood flow to the brain, and the brain responds with dizziness, lightheadedness, and sometimes brief visual disturbances or nausea.
The second major cause of post-meal dizziness works through a completely different mechanism, and it is one that is becoming increasingly common in adults over 50. When you eat a meal high in refined carbohydrates, white bread, pasta, rice, sugary drinks, or processed foods, your blood sugar rises rapidly. Your pancreas responds by releasing a large surge of insulin to bring that blood sugar back down. But in many adults, this insulin response overshoots. It releases more insulin than is actually needed. The result is that blood sugar drops too low within 1 to 3 hours after eating, a condition called reactive hypoglycemia. When blood sugar drops too low, the brain, which depends entirely on glucose for fuel, immediately sends distress signals. And one of the first and most noticeable of those signals is dizziness, along with shakiness, sudden fatigue, and difficulty concentrating. Research suggests that reactive hypoglycemia is far more common than most people realize, particularly in adults with early insulin resistance, or pre-insulin resistance, or prediabetes.
The third cause is one that most people, and even many general practitioners, are not fully aware of. The vagus nerve is the longest nerve in your body, running from your brainstem all the way down through your neck, chest, and abdomen, directly connecting your brain to your digestive system. After eating, particularly after a large meal, the vagus nerve can become overstimulated by the stretching and activity of the stomach and intestines. In some people, this overstimulation triggers what is called a vasovagal response, a sudden drop in both heart rate and blood pressure as the nervous system briefly overreacts to the digestive signals it is receiving.
The result can be a sudden, intense wave of dizziness, nausea, sweating, and in some cases, brief fainting. All triggered not by what you ate, but by the mechanical act of your stomach filling and stretching. This response is more common in people who eat large meals quickly, and it becomes more pronounced with age as vagal regulation becomes less precise.
Most post-meal dizziness is uncomfortable, but not dangerous. However, doctors say there are specific warning signs that require immediate medical attention. If your post-meal dizziness is accompanied by chest pain or tightness, seek emergency care immediately, as this combination can indicate a cardiac event. If you experience dizziness with sudden difficulty speaking, weakness on one side of your body, or sudden vision changes, this is a potential stroke emergency and requires immediate action. If you faint or lose consciousness after eating, this must be evaluated by a doctor as soon as possible. If your post-meal dizziness is getting progressively more frequent or more severe over time, or if it is accompanied by significant weight loss, persistent nausea, or vomiting, in all other cases where dizziness after eating is mild, consistent, and without these serious accompanying symptoms, it is most likely postprandial hypotension or reactive hypoglycemia, both of which are manageable with the right approach.
The good news is that for most adults, post-meal dizziness is highly manageable once you understand what is causing it. Doctors and dietitians recommend 5 evidence-based strategies. First, eat smaller, more frequent meals. Large meals cause the biggest blood flow shift to the digestive system. Smaller meals reduce this shift dramatically, and spreading meals across the day helps keep blood pressure and blood sugar more stable. Second, reduce refined carbohydrates at meals. Choosing lower glycemic foods, vegetables, lean protein, legumes, whole grains, instead of white bread, pasta, and sugary foods, significantly reduces the insulin surge that causes reactive hypoglycemia. Third, stay well hydrated before and during meals. Dehydration makes postprandial hypotension significantly worse. Drinking a full glass of water before eating helps maintain blood volume. Fourth, sit and rest for 20 to 30 minutes after eating before standing. This gives your autonomic nervous system time to compensate for the post-meal blood pressure shift. Fifth, eat slowly. Eating more slowly gives your body more time to manage the digestive blood flow shift before it becomes overwhelming.
If post-meal dizziness is affecting your daily life, making you afraid to eat out, causing you to lie down after every meal, or happening more than a few times a week, this deserves a direct conversation with your doctor. A simple blood pressure measurement taken before eating and then again 30, 60, and 90 minutes after eating can confirm postprandial hypotension quickly. A glucose tolerance test or continuous glucose monitoring can reveal reactive hypoglycemia patterns that a standard fasting blood test might miss entirely. Your doctor may also review your current medications, as several common medications, including certain blood pressure drugs, diuretics, and diabetes medications, can significantly worsen post-meal dizziness as a side effect. Post-meal dizziness is not something you simply have to live with. It has identifiable causes, and with the right diagnosis, most people find that targeted changes make a meaningful difference within weeks.
Here is what we know. Feeling dizzy after eating is not random, and it is not something you have to simply accept. It happens because digestion requires a massive shift in blood flow, and in many adults, the body's systems for managing that shift do not work as efficiently as they should. Postprandial hypotension causes blood pressure to drop after meals when the autonomic nervous system cannot compensate fast enough. Reactive hypoglycemia causes blood sugar to crash after high-carbohydrate meals due to an overshooting insulin response. And vagal overstimulation from a stretched, active stomach can trigger sudden dizziness and nausea through the nervous system directly. Eating smaller meals, choosing lower glycemic foods, staying hydrated, resting after eating, and eating slowly are all evidence-based strategies that may meaningfully reduce how often this happens. And if your symptoms are frequent or severe, speak to your doctor. Your body is not broken. It is asking for a different approach. Subscribe to Anatomy Visual Lab. Every week, we explain what is happening inside your body, clearly and without confusion.